Hi everyone, again it's Dr. Ashley and I'm answering your questions in the comment section on my page. All right, here we go. So this next question right here that I got from one of my followers, from one of my subscribers, he says, I'm a doctor. Can I work in this field, assuming healthcare administration, and what qualifications should I obtain? Now, given that I believe you're from Lebanon, so I'm assuming that you plan to eventually move to the US or Canada or UK, one of these, and you want to be able to work in healthcare administration rather than as a physician, or rather than trying to, I guess, convert your qualifications to American standards and then be able to work as a physician and all of that. I know that can be hard, and a lot of people who might be physicians in other countries, they come here and they're like, I'm gonna do something else in healthcare, which I get it. So some things that I think you need to keep in mind. So what I'm gonna go through in this video is we're gonna talk about some potential career goals that you might want to keep in mind. We're going to talk about what you need to do some research on to learn about the system, the healthcare system that we have in the United States, and also any potential ones that you want to explore as well. Like if you're trying to go to the UK maybe, or Canada, or any other country and do the same thing in. Look at different qualifications that you might want to consider, and also how to, if you're finally in where you want to be, whether it's the United States, wherever, leverage your background to get the most out of your career. Okay, so get started in this video. All right, so first, you as a physician, you're already bringing a wealth of knowledge and experience to healthcare administration. So transitioning to this field might be very natural. It might be a very natural fit for you. Your background gives you like an understanding of patient care, clinical workflows, healthcare systems. So you're already set in those areas, correct? Now, if you're coming to the United States from Lebanon or any other country, all of our healthcare systems are a little bit different, so it's not going to be exactly the same. It's not going to be what you're used to completely. What I say here is that you need to, if you're thinking United States, you need to start researching the United States healthcare system. So you want to look at how we do our healthcare delivery system. You want to look at private, public, and insurance-driven components of how our healthcare system works. Okay, you need to go and familiarize yourself with how a lot of businesses work, how hospitals are ran, clinics, hospitals, look at pharmaceutical companies. Okay, so get familiar in all the different areas. Also look at the public sector. So look at public health, see how that is being ran, and the focus of public health, what public health likes to focus on versus what the private sector likes to focus on in healthcare. So just get a good understanding of that. Get a good understanding of how insurance works, whether it's public insurance and private insurance. Because knowing that will give you a very, very good idea of how it's ran. Okay, and that also might give you an idea of like exactly where you may to work as a health administrator in the United States, if that's where you want to go. Okay, so some ideas for health administration that might excite you. You can look into hospital administration. So you could be managing operations, finances, hospital staff. You could also look into health management. So you could oversee healthcare programs or policies in like the community level, like this level, county level, even state or national level. Okay, so depending on where you work and like the scale of it. Okay, so you would want to understand how public healthcare system works in the United States as well, because if you think you want to work in the public sector, that may be something you want to do. Also, if you're really interested in technology, AI, IT stuff, you may consider health management as well. So a lot of this is going to be working on healthcare records, healthcare technologies, data, keeping of systems, keeping of protocols that physicians use, and then also, patient records and things like that. So that might be something that interests you a lot, if you're a techie kind of person. Also, maybe you went into consulting. Okay, so that's another option that you want to think about, advising healthcare organizations or advising patients. If you're working on more of the business end of healthcare administration and you get into consulting, you would be advising healthcare organizations on how they might want to improve their efficiency and how they can improve patient care, like reduce medical errors and whatnot. So those are just some ideas that you might want to look into if you do want to get into healthcare administration. Given that you're a physician, you are already a healthcare worker and like a high prestige, you've already obtained your higher education. I think it would be worth it for you to go for something a little bit more higher up if you're trying to look at a career within the United States in healthcare administration. Okay, so don't aim high is what I'm saying. So some qualifications that you're going to want to consider doing some research on would be, of course, getting a master's degree. So get a master's degree in healthcare administration, or an MBA is fine. But because you already know healthcare. Okay, so get an MBA. You can even get one with a focus on healthcare as well. Okay, so that will help provide you with book knowledge on management, finance, marketing, healthcare operations, things like that. Okay, so you can go ahead and take care of that end of, of that end of your career. You also may want to consider getting certifications. So depending on how far you want to take this step, your career, you can get healthcare management. You can join fellowships, and you can get certified, become a certified professional in healthcare quality. Focuses more on quality improvement and patient safety, so that's something you may want to think about. You may want to think about being in Lean Six Sigma or project management. So that's good if you want to get into like improving efficiency, if you want to get into especially. So that would be a really good for you to look into. Definitely as a physician, and once you get your master's, you are going to want to look getting into fellowships. Okay, so especially once you're able to come over here and start moving through the system and building on your career, I would say you definitely want to look into fellowships. Okay. Fellowships of healthcare executives, because like I said, I think you need to aim high. Okay. And then at some point start leveraging your medical background. Okay, like yes, now you're doing well management end. Now let's fit in your medical background to that. Right. So you should start considering transitioning into roles like medical chief or chief medical officer. Okay, medical director. All right. These types of roles, they're gonna come a bit later. You may be working over 5 years before you even think about that, but I think this is something that you should keep in mind. Okay, so looking at more director, executive roles. So some networking and experience that will along the way. You should join healthcare organizations like ACHE and HIMSS. I would Google those right now and figure out how you can go ahead and become a member, because joining those networking organizations on those websites, they have more exclusive, like conferences that you can go to and network with other people who are trying to do the same thing as you. So you can get a lot of information. You can connect with people who might be a little bit ahead of you, and just it would be really helpful. So if you really want to proactively get yourself from over there to over here and become a medical executive, this is what I would do. All right. So I hope this video helps you. Good luck with everything.